Hi all, this is Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I'm going to discuss about a therapy with the help of ice called cryotherapy. So in this presentation, I'm going to define the cryotherapy and its clinical purpose and also explain the cryotherapy's biophysical tissue effects. And also in this presentation, we are going to learn about the Lewis-Hunter reaction and its significance, and we are going to identify the clear clinical indication for the cryotherapy and recognize the contraindications and safety measures, and to gain the knowledge about the clinical decision making in application of the cryotherapy. To start with the definition, purpose, and its types, to define the cryotherapy, it applies the cold temperature to body tissue to induce the physiological effects such as pain relief, inflammation reduction, and metabolic rate decrease in injured areas. So, where we'll use this cryotherapy to manage the acute musculoskeletal injuries clinically. So, it will help control the edema to reduce the inflammation and elevate the muscle spasm and pain, improving the recovery outcome after injury. So, to differentiate between the localized and whole body cryotherapy, so localized cryotherapy includes ice packs, cold sprays targeting a specific area, while a whole body cryotherapy employs controlled cold chamber in which the entire body is immersed in it. That will produce the systematic effect. So here is the biophysics of the cryotherapy, which cold effects on the tissue. So the first thing is heat transfer by conduction. The cryotherapy primarily transfers heat away from the skin and the tissue through the conduction, which is essential for the lowering the tissue temperature in the cryotherapy. The next biophysics response is vasoconstriction response. The cold exposure will cause the blood vessels to constrict and also reduces the blood flow and limit the edema formation. So that is critical for managing the inflammation. So that is the second response happens in the cryotherapy. The third response is the metabolic rate reduction. Cooling decreases the cellular metabolism, lowering oxygen demand and minimizing secondary tissue damage during the injury recovery. So that is the third biophysics happens in the cryotherapy. The next biophysics of the cryotherapy is the slowed nerve conduction. So cold reduces the nerve conduction velocity, producing analgesia that helps elevate pain in treated area. So the last effect of the cryotherapy is the thermal gradient control. The temperature difference between the cold source and the tissue dictates the depth of the effect. So controlled exposure of the cryotherapy will prevent the frostbite and the tissue injury. So these are all the 5 biophysics of cryotherapy which is happening in the tissues during the application of cryotherapy. So to decode the Lewis-Hunting reaction to cold response, so in Lewis-Hunting reaction after application of cryotherapy, initially there will be a vasoconstriction at the tissue. And the next is the cyclical response. Cyclical response involves vasoconstriction followed by vasodilatation, which is happening in a repeated way is called as a cyclical response. So intermittent vasodilatation appropriately 5 to 10 minutes after the cryotherapy will dilate periodically the blood vessel to restore the blood flow and prevent the ischemic tissue damage. So to imply that clinically, we have to understand the Lewis-Hunting reaction and guides the therapy duration to maximize the benefits while avoiding the cold injury risk. So what are the clinical indications for effective cryotherapy use is mentioned here. So for the applying cryotherapy for acute musculoskeletal trauma, first 48 to 72 hours to reduce the swelling, pain, which is used in sprain, strain and contusions. And in post-surgical inflammations, post-operatively to minimize the inflammatory response and promote a faster healing tissue. And to manage the soft tissue injuries also, it will enhance the patient comfort and speedy recovery. And to treat the acute inflammatory conditions for bursitis, tendinitis to decrease the inflammation and provide the analgesic effects. And to modulate the neuropathic pain selectively, use cryotherapy in certain neuropathic pain cases to alter the nerve conduction and to improve the pain control. So these are all the effective clinical indications for cryotherapy uses. And what are the contraindications there for a cryotherapy, or what are the unsafe and ineffective states are there in cryotherapy? So absolute contraindications include cold hypersensitivity, example Raynaud's phenomenon, cryoglobulinemia, peripheral vascular diseases, and open wounds without protection or absolute contraindication for cryotherapy. And for relative contraindication, impaired sensation or communication, application over the superficial nerves, hypertension or cardiac conditions, or the relative contraindications for the use of cryotherapy. So, what are status there need a caution in using the cryotherapy? Avoid prolonged exposure to prevent the frostbites or tissue damage, and continuously monitor the patient's response to the cryotherapy is needed. So, how to apply the cryotherapy safely with a stepwise protocol? First thing is we have to assess before the application. Assessment of the adverse effects and assessment of the local area of application is generally needed. The second step is the skin protection preparation. So we have to use a protective barrier like a towel to shield the skin and avoid direct contact with the eyes and prevent the cold-induced injury. The third thing is controlled cold application. Apply cold or ice pack for 10 to 20 minutes. Ensure no direct eye contact to maintain the therapeutic effect while preventing the frostbite. And the fourth one is continuous monitoring. We have to observe the skin for excessive redness or numbness during the application to detect the adverse reaction early and adjust the treatment accordingly. The fifth one is scheduled intervals. Repeat cryotherapy every 1 to 2 hours as indicated, respecting the Lewis-Hunter's reaction timing to balance the vasoconstriction and reperfusion. So this is the stepwise protocol to apply the cryotherapy. So how is effective cryotherapy in acute ankle sprain management? So patient with a grade 2 ankle lateral sprain and cold packs applied immediately and regularly. Compression and elevation which complements with the cryotherapy will give you a better output, and we have to monitor for the adverse effects vigilantly, and outcome shows rapid edema and pain reduction. Adherence to contraindications prevents the complications. So this is the effective cryotherapy in managing the acute ankle sprain management. Thank you.